What is osteopathy is something that people ask me quite frequently, and the best way to think about it or explain it is we're a holistic manual therapy. Okay, so we use our hands to treat people. We don't prescribe drugs or medicines or anything like that, but we look at the whole person and the whole body. So we really want to know information about their life, how they're doing, what they've been doing, what their problem is, and how we might be able to help and treat that. Majority of the work we do is within musculoskeletal medicine, and in order to be an osteopath in the UK, you need to go to one of the 9 institutes that are registered with the General Osteopathic Council. In order to be registered, these institutes, Marjon is one of, you have to fulfil the criteria that is in the OPS, which is the Osteopathic Practice Standards, and the GOPRI, which is the Guidance for Pre-Registered Osteopathic Education. Our program is 4 years long. It's integrated masters, which you will enter at undergraduate level, so after your A-levels or equivalents, and then you'll progress through the 4 years, and when you leave, you'll be a registered osteopath with the General Osteopathic Council, which means you can call yourself an osteopath and practice in the UK and many other countries as well. So at Marjon, we fulfil all the criteria required from the General Osteopathic Council, and we're also looking at how we can fulfil the criteria required from the ACP, so the Advanced Clinical Practitioner, and the FCP, which is the First Contact Practitionerships. These are NHS-based initiatives which allow multidisciplinary practitioners to work within the NHS. At the moment, we're looking at how we integrate these 4 pillars, which are clinical practice, leadership and management, research and education within the programme, to allow there to be easier transferable skills between private practice and within the NHS.
I already work in allied health field, and I've worked with osteopaths for many years and basically been wanting to learn to do this for a long time. I find the course really interesting from year 1 until now. I'm in the 3rd year, and obviously now that we're seeing patients, it's all bringing everything together. Practical experience is really beneficial.
I'm a sports massage therapist, and I've had run a business since I was 20, and I decided I wanted to progress, and osteopathy seemed like the right kind of thing. I like wanted to get a bit more into exercise and rehab and further with manual therapy, and osteopathy had a whole body approach. That's what I'm looking for, which I really liked, which was why I chose it over physio and chiropractor. I'd like to stay in England for at least for a year and hopefully work in the clinic I'm working at the moment, and then I'm hoping to progress to move to some places in Europe and maybe work with some sports teams and then progress with pain clinics and stuff out as it goes from there. So that's my plan. Because you get so much more one-to-one really, and group sizes are small. It's lovely being in like a small classroom setting. I like it a lot.
I've always had an interest in healthcare. I've worked in the NHS and been a personal trainer for 20 years. I looked into other courses like chiropractic, physio, and this one just stood out for me because of, 1, the location, 2, the level of knowledge and the way that the osteopathic course itself was presented in terms of the way that it looks at the body as a whole. It's something I've always believed in my career, hence why I'm here. I actually like the fact that it's a slightly smaller, more tight-knit community, because you get a level of care that you potentially wouldn't at bigger universities. You don't just become another number and a face lost in the crowd. I love the attention that you actually get from staff in all areas. I think it's fantastic. The heavy practical element was really good, especially for myself. I'm quite a practical learner. I can't sit in lectures. I'm not that great at them. So much like anything, it doesn't matter what you know, it's how well you apply it. And that practical element really helps with that. I already know where I'm going. I've got a vacancy in a clinic in Exeter near to where I live. So I'm going to spend most of my time there and potentially set up my own online business at the same time.